5. Pandemic preparedness. Learning objectives. At the end of the session, the participant be able to 1. Discuss the factors that contribute to the development of pandemic infectious diseases. 2. Recognize pandemics and the potential risks it poses to business establishments. 3. Summarize the effects of a pandemic on business continuity. 4. Discuss the steps in the development of an effective business continuity plan amidst a pandemic. 5. Discuss strategies and steps in pandemic preparedness. Infectious diseases cause suffering and death. Continuing threat to all persons, regardless of age, sex, lifestyle, ethnic background, socioeconomic status. Impose a financial burden on society. About 15 million, 25%, of 57 million annual deaths worldwide are the direct result of infectious disease. Figures published by the World Health Organization. ASCAI. Alt. Pandemic infectious diseases are among the greatest of all threats to human health and security, against which we have for too long done little to prepare. ASCAI. Alt. Factors leading to the emergence of infectious diseases. Poverty and social inequity, intent to harm, war and famine, lack of political will, rightward arrow, changes in demographics and behavior, environmental change and land use, breakdown of public health measures, microbial adaptation and change, international travel and commerce, changes in technology and industry, rightward arrow, increase in host susceptibility, new diseases, increase in disease transmission, rightward arrow, emerging infectious disease. ASCAI. Alt. Modern demographic and ecologic conditions that favor the spread of infectious diseases include rapid population growth, increasing poverty and urban migration, more frequent movement across international boundaries by tourists, workers, immigrants, and refugees, alterations in the habitats of animals and arthropods that transmit disease, increasing numbers of persons with impaired host defenses, and changes in the way that food is processed and distributed. The single biggest threat to man's continued dominance on the planet is the virus. Joshua Lederberg. ASCAI. Alt. The World Health Report 2007, A Safer Future Global Public Health Security in the 21st Century. It would be extremely naive and complacent to assume that there will not be another disease like AIDS, another Ebola, or another SARS, sooner or later. ASCAI. Alt. A global epidemic far worse than the Ebola outbreak is a real possibility and could kill many millions if the world does not become prepared to deal with the sudden emergence and transmission of disease. United Nations Panel, February 2016. ASCAI. Alt. Epidemics and pandemics in the 21st century. Origins. Re-emerging known epidemic diseases, e.g. Ebola, cholera, yellow fever, HIV, etc. Newly emerging infectious diseases, e.g. SARS, H1N1 influenza, MERS, COVID-19. Dynamics. 1. Emergence in a community. 2. Outbreak with localized transmission. 3. Outbreak amplification into an epidemic or pandemic. 4. Reduced transmission. Global spreading. Unprecedented high speed of transmission worldwide. Global integration. Travels. Urbanization. What makes a FIAC? Public health emergencies of international concern. The virus is a public health risk to other states through the international spread. It could require a coordinated international response. The situation is serious, unusual, or unexpected. The decision to declare a FIAC is made by the WHO's Director General and a committee of experts. Source: the World Health Organization. An extraordinary event which constitutes a public health risk to other states through international spread of disease and which requires a coordinated international response. A situation that is serious, unusual, or unexpected which carries implications for public health beyond the affected state's national border and may require immediate international action. 1. Influenza A, H1N1. 1. April 2009, H1N1, swine flu. 2009, influenza A, H1N1, virus infection led to global epidemic, or most popularly known as pandemic. On June 11, a full pandemic alert was declared by the WHO. ASCII. Alt. 2. May 2014 Wild polio virus. ASCII. Alt. 3. August 2014, Ebola virus disease outbreak in West Africa. The outbreak of Ebola in West Africa is the largest in history in terms of the number of cases, deaths, and geographic spread before this outbreak of COVID-19. The epidemic began in Guinea during December 2013, and the WHO was officially notified of the rapidly evolving outbreak on March 23, 2014. The cases have spread to its capital city and to its neighboring countries of Liberia and Sierra Leone, after being initially confined to a rural area Guinea. On July 25, 2014 Nigeria reported its first probable case and death. Senegal reported its first confirmed case on August 29, 2014. Disease Prevention and Control Bureau, DO. ASCII. Alt. 4. February 2016 Zika virus disease. ASCII. Alt. 5. January 30, 2020 COVID-19. ASCII. Alt. 6. July 23, 2022 Monkeypox, now Pox. ASCII. Alt. Tracking a potential pandemic. Interpandemic, Phase 1, new virus in animals, no human cases, low risk of human cases. Phase 2, higher risk of human cases, pandemic alert new virus causes human cases. Phase 3, no or very limited human-to-human transmission. Now at Phase 3 companies should develop risk mitigation plans. Phase 4, evidence of increased human-to-human transmission. Phase 5, evidence of significant human-to-human transmission, pandemic. Phase 6, efficient and sustained human-to-human transmission source WHO. ASCII. Alt. Commerce is shut down, schools closed. Supply shortages, medical supplies, food, etc. Vaccines may be inadequate, if available. Hospitals could be overwhelmed with patients. Rapid spread due to fast mode of transport. Panic and looting, Hurricane Katrina-like. Effect of a pandemic on business. Scenarios. Avian flu scenario. Harvard Business Review Report, May 2006. The single biggest threat to the business community would be an avian flu, H5N1 pandemic. Companies need to wake up to the threat and create a business continuity plan, BCP, that specifically address the risk of pandemic. The global nature of a flu pandemic makes it fundamentally different from traditional business continuity threats, i.e., strike, hurricane, etc. Logistic breakdown. Supply chain disruptions. Security concern. Borders may be closed. Drop in demand of many products and services. Forecast minus 1/3 of workforce out sick or otherwise unavailable. World Bank forecast. With the worst scenario level 6 of pandemic alert, estimated global economy cost $800 billion, $1 trillion. ASCII. Alt. Effect of a pandemic on business. Reduced labor supply. Reduced business or cancelled customer orders. Interruption in getting supplies or materials. Change in demands. Reductions or restrictions on public meetings or gatherings. Restrictions on travel. Reduced availability of healthcare or home care services. Reduced availability of child daycare services. In more severe situations, disruptions in services such as telecommunications, financial/banking, water, electricity, gasoline/fuels, medicine, or the food supply. Level 6 business impact. Manufacturing operations could slow or stop due to lack of raw material. Supply chains could be interrupted or broken, borders could be closed or port workers down, slow shipping. Utility interruptions could occur due to workforce illness. Companies would try to operate with half the workforce gone. Pre-pandemic planning. Disease outbreaks often strike quickly and without warning. Organizations should be ready. Be aware of potential risks. Be up to date on pandemic information. Have contingency plans in place. Corporate BCP. Business continuity plan amidst COVID-19. A documented procedure that guides an organization to respond, recover, resume, and restore itself to a predefined level of operation following a disruption. 1.1 Business Management. Ensure that the responsibilities and authorities for relevant roles are assigned and communicated within the organization. Carry out business impact analysis and risk assessment. Gather necessary information relevant to the nature of the organization's operations. Gather and communicate relevant updates. 1.2 Human Resource Management. Appoint a health and safety manager to perform the following. Actively monitor the development of the pandemic. Coordinate with the management and all employees to ensure effective communication and implementation of procedures. Provide relevant information to employees. Conduct, or appoint an alternate, temperature and symptom monitoring of employees and clients. Monitor closely all employees, clients, and visitors that show symptoms. Ensure availability of adequate supplies. Maintain an updated contact information database of all employees. Devise feasible alternative work arrangements. Ensure that non-essential business travels are deferred and be updated on travel advisories by the DFA. Define clearly management policies on leave of absence, hospitalization, benefits, health insurance, social security benefits, and employees' compensation benefits. Monitor health conditions of all personnel. Implement public health response measures such as contact tracing and social distancing as advised by the DOE. Sample notification form for employees. ASCII. Alt. DTI, Business Continuity Planning amidst Coronavirus Disease 2019, COVID-19. 1.3 Process and Business Functions. The organization shall identify critical business functions and designate employees to carry out appropriate functions, work from home, skeleton workforce, alternating schedules, or shifting schemes. Paperless and cashless transactions are encouraged. Devise alternatives in the conduct of meetings/training/seminars, virtual. Develop client and employee screening procedures for individuals entering the workplace, temperature reading, sanitation of hands and footwear. Implement the use of a health screening form for employees and visitors, via web/mobile app, or actual printed forms. Maintain cleanliness of the office environment and arrange regular disinfection protocols throughout the workplace. Sample health screening form. ASCII. Alt. 1.4 Supplier and Customer Management. Identify essential suppliers and service providers. Set parameters for when to activate contingency measures based on current situations that may cause limitations on operations. Identify essential customers and ensure that plans are in place to meet customers' needs. BCP shall be available as documented information that may be communicated within the organization and may be available to interested parties, as appropriate. Organization shall determine internal and external communications relevant to the business continuity. Organization shall appoint a communications coordinator to ensure efficient dissemination of business continuity plans and other essential information internally and externally. Business Continuity Plan. Step 1. Identify your key products or services. Step 2. Establish the objective of your BCP. Step 3. Evaluate the potential impact of disruptions to your enterprise and workers. Step 4. List action to protect your business. PCOM Worker Health Advisory, Workplace Readiness. ASCII. Alt. Step 5. Establish contact lists. Step 6. Maintain, review and continuously update your BCP. PCOM Return to Work, Interim Guide on Health and Safety in the Workplace. ASCII. Alt. HROD's role. Post-outbreak. Compensation and benefits. How can organizations compensate employees in the event of closure of facilities, quarantines, or employees' decision not to come to work during an outbreak? Alternative work arrangements. If regular business course is interrupted, how can we enable employees to perform their jobs? Employee assistance. How do we handle emotional/financial assistance to employees? Four-door approach to the prevention and control of ID. Point of origin, point of entry, point of care in the hospital or community, epidemic surge, point of increased demand and point of widespread transmission. ASCII. Alt. Four-door policy of intervention for ID prevention and control.